Coverage continues now of Congress passing President Trump's signature spending bill, which will cut federal spending on Medicaid and the Affordable Care Act by about $1 trillion over the next decade. That's according to the Congressional Budget Office, which adds nearly 12 million people could be left without health insurance by that time. Critics of the bill, which now heads to the president's desk, says that this threatens the physical and also the financial health of tens of millions across the United States. Joining us right now is Dr. Vin Gupta, pulmonologist and NBC News medical analyst. Doctor, thanks for being with us.
Good evening, Jessica. Thanks for having me.
So critics, as I mentioned, of Trump's bill say this is going to reverse many of the health care coverage gains made by the Biden and Obama administrations. And we're talking about those massive cuts to Medicaid and the Affordable Care Act. What are the immediate as well as long-term impacts?
Sure. Unfortunately, there are several. And I think whether you're a Republican or whether you're a Democrat, you're watching, it's important just to focus on the facts. And what this does is this removes over the course of a decade about $1 trillion from Medicaid. I think it's important to keep in mind 70 million Americans, both children and adults across the country, rely on Medicaid for their primary access to health care. It's their primary health insurance. And the ways in which this is afforded across the country is through both state and federal subsidies. The way that states do that is they actually tax hospitals and other providers. And in doing so, they create that income that then allows them to draw federal subsidies. So, Jessica, what ends up happening with this bill is limiting the amount of taxes a state can collect that then can go towards requesting a federal match. And so if you're reducing the amount of money that Medicaid can garner in any specific year because of these taxes, there's far less people that can actually benefit from receiving benefits through Medicaid. And what's going to happen? Far less people on Medicaid, far less in the way of hospitals actually receiving revenue by caring for these patients. And that's why we're thinking through or estimating about 300 hospitals across the country are going to close as a result of today's bill passing. That's because of the ways in which revenue dollars, the ways in which just support for this program, this federal program, is being reduced. These are called provider taxes. And we don't talk about that often. Planned Parenthood, Jessica, real quick. 1 in 3 women across the country at one point in time get their primary health care access through Planned Parenthood. This puts a 1-year moratorium on any Medicaid dollars being spent on Planned Parenthood. That's going to be a big deal for primary care access. And then lastly, I'll just say 60% of skilled nursing facilities across the country are funded by Medicaid. What happens now when we lose $1 trillion in the system? Less skilled nursing facilities, less nurses to populate those nursing facilities. So this is going to have broad-based outcomes and impacts on all 70 million Americans, not just a small few.
A lot to follow up there, but you mentioned those hundreds of hospitals that could close. What does this mean specifically for rural communities, which often rely on those tax dollars, as you mentioned, and also nursing homes in those areas?
Well, we know that rural communities and nursing homes tend to be safety nets for a lot of people, especially in suburban and ex-urban communities. And so they're going to be devastated. Let's just call it what it is. There's going to be an impact on rural hospitals. We're already seeing it. But $1 in $5 that are spent on healthcare in the United States are Medicaid dollars. So this is not just going to impact the rural hospital, Jessica. It's going to impact Harborview. It's going to impact the hospital that I'm currently sitting at here in First Hill in downtown Seattle as well. And this also ultimately going to have ramifications on the amount of patients that we can serve adequately and the amount of healthcare providers that will have jobs. We're already seeing people losing their jobs. Less patients to care for, less money in the system. Healthcare is the biggest part of our economy. Less people that we're actually going to be able to employ. So this is going to impact not just patients, but providers and jobs.
Doctor, real quick, can we talk about the patients? Let's talk specifically about that Medicaid work requirement, because it could cut off coverage for millions of people who can't meet that employment standard. So what kind of complications do you foresee for people, especially who can't work because of perhaps a disability, childcare, or maybe they're in school?
Well, I think it's important to note that there's exceptions for disabilities, and you have to just verify that and provide documentation. What I'm worried about is every 6 months now the government is saying you have to provide verification on either an exception or that you're working. And this bill says $75 million is going to be enough for 50 states to implement work requirements and the technology required to verify those work requirements every 6 months. It's a lot. We don't do that today. It's a lot of administrative and technological burden we're going to impose on states. I'll just say for your viewers, in 2018, the state of Kentucky tried to implement work requirements for its population. They spent $250 million, Jessica,
Wow.
and they couldn't do it successfully. It was still too complicated, too much administrative hassle. This bill has $75 million for the entire country to do something that's going to be a lot of administrative hassle. Well, my worry here is that this is going to result in a lot of paperwork, a lot of long lines for people on Medicaid. And oh, by the way, that's going to create a long line for people on Medicare wanting their Social Security benefits, et cetera. Because if there's a line in one part of government, it's going to cause a ripple effect in other parts of government. So make no mistake, it's easy to talk about work requirements. It's a lot harder to implement it. And this requires a lot of resources, and this bill does not have those resources.
Dr. Vin Gupta, I really appreciate your time. We're running out of time to talk right now. There is so much to unpack, so we really hope you'll be back with us. We appreciate it.
Thank you.
Thank you.